And welcome back to the Kiosk Presents. Joining me today is Dr. Stephen Quay, Chairman and CEO of Atosa Genetics. He's certified in anatomic pathology, and Elizabeth Salerno, patient and medical assistant. Thank you so much for joining us today.
Thank you.
It's a pleasure.
All right. Now, obviously breast cancer is a big deal and a lot of people are taking it to heart, but there's so many new advances in science. What can you guys tell me about what's going on with breast cancer detection and awareness?
Well, sure, Stephen. The Foresight Breast Health Test, which is a process that I invented about 12 years ago and is now being offered around the country, is really a very new process, not looking at cancer of the breast, but looking at the hyperplasia that causes cancer. So much like the pap smear for cervical cancer has prevented 80% of cervical cancers by finding that 8 to 10 year process that leads to cervical cancer, the Foresight test does the same thing, finds what we call milk duct hyperplasia that if left untreated in 10 to 15 years will lead to breast cancer.
All right. Now, what is memory aspiration specimen cytology test system? I know it's a mouthful, but...
It is a mouthful, and that's why we call it the Foresight breast test. It's a modified breast pump that's used by a nurse or practitioner in a OBGYN or doctor's office together with a heating pad to collect a small specimen from the nipple in a non-invasive, relatively pain-free fashion. The specimen is then sent to our laboratory in Seattle, Washington, where we do some very special tests to identify the cellular changes that, if left unchecked, could lead to breast cancer.
Okay, that makes a lot of sense. I'm sure all our female viewers love the pain-free part. Why is it recommended with mammograms, and who would you recommend it for? What age ranges?
Yeah, so because hyperplasia leads to breast cancer and takes 10 to 15 years, and breast cancer peaks in the 45 to 60-year-old range, we really think that women between 20 and 50 are most appropriate for this test. The mammogram is designed to find cancer, which you then treat surgically with radiation and then chemo. This is to find the precursor, the reversible hyperplasia that can lead to breast cancer when you can treat it with either lifestyle interventions or medical treatment.
That's very cool. Now, when somebody wants to go and get this test done and they're not sure how to do it, how do they ask their doctor?
Well, I think I would start by having them go to our website, myforesight.com. It's a site that would identify a doctor in their area who's administering the test, and also provides information that they could take to their doctor if their doctor isn't currently a prescriber of this process. So it's myforesight.com.
Okay, so myforesight.com gives them all the information as well as more specifics on this test if they're curious?
Absolutely, Stephen.
Okay, well, that's very good information to have, and it's great that you're continuing the field of research into this and preventing further cases of cancer. It's great to have you on the show. Is there anything else you want to make sure that every woman in Western New York is aware of?
No, it's just that we're going to be celebrating Breast Cancer Awareness Month in October, and I'd really like to have September someday be Breast Cancer Prevention Month by finding these precursor lesions with the Foresight test and stopping breast cancer from even occurring.
All right, well, thank you so much, Dr. Stephen Quay, for joining us here on the Kiosk Presents, and have a great day.
Thank you, Stephen.